It's Cystic Fibrosis Awareness Month. Now, the genetic disease is one of the deadliest in the country, but how much do we all really know about it? That's a big question. Well, here's more in Hump Day Health. Dr. Marilyn Prince-Fiocco now serves as a pulmonary physician at New-Hanover-Regional-Medical-Center. Before that, she worked in several adult cystic fibrosis care clinics.
Cystic fibrosis is a genetic disease. It's actually the second most common severe genetic disease especially in Caucasians.
Better known as CF, it's a disease discovered at birth. Hundreds of different gene mutations can lead to the diagnosis, the most common being defect F delta 508. Each case varies, but there are a host of usual symptoms.
The cystic fibrosis, patient chronically has the kind of phlegm that brings most people without disease to the doctor.
Phlegm sits in the lungs, airways, and sometimes multiple organs for CF patients. They take special medication to digest food, clear mucus from their lungs, and fight off bacteria.
The failure to be able to clear that phlegm means that the infections that are bacterial, especially, are fostered, and the infections gradually further damage the lungs.
Awareness for the chronic condition is spearheaded by the cystic-fibrosis-foundation. Funding for research in the past decades has significantly helped reduce the effects of the disease.
Telling somebody that your baby has CF, and it used to be that was almost a death sentence within the first few years, but now the median lifespan is 37. And many patients live into their 50s, and which is certainly true.
For Hump Day Health, I'm Andrew James. Now, you just heard earlier in the show from the Lilleys, whose child is a patient with CF. You can support families like theirs and mine this weekend by giving and taking part in the Great Strides Walk for Cystic Fibrosis that's being held over at Hugh McRae Park. We have more on that on WWYTV3.com.